Bismillahirrahmanirrahim. Quote of the day: an ounce of prevention is worth a pound of cure. Today, the topic of my presentation is Global and National Action Plan for the Prevention of Non-Communicable Diseases. Learning outline of my presentation is Introduction, Global Plan of Action, 9 voluntary targets of 2025, National Plan of Action, recent updates and MCQs at the end. At the end of this presentation, participants will be able to describe the Global Plan of Action, National Plan of Action for the non-communicable diseases and recent updates. Introduction. The World Health Organization has developed a strategy to reduce premature mortality from non-communicable diseases by 25% by the year 2025 by setting targets for improvement in obesity, diabetes, raised blood pressure, tobacco use, salt intake, physical inactivity, and harmful use of alcohol. Mainly, there are 6 objectives of this global plan of action regarding non-communicable diseases: to raise the priority according to the prevention and control of non-communicable diseases in global, regional, and national agendas and internationally agreed developmental goals through strengthen international cooperation and advocacy, to strengthen national capacity, leadership, governance, multi-sectoral action and partnership, to accelerate country response for the prevention and control of non-communicable diseases, to reduce modifiable risk factor for non-communicable disease and underlying social determinants through creation of health promoting environment, to strengthen and orient health system to address the prevention and control of non-communicable diseases and the underlying social determinants through people-centered primary health care and universal health coverage, to promote and support national capacity for high quality research and development for the prevention and control of non-communicable diseases, to monitor the trend and determinants of non-communicable disease and evaluate progress in their prevention and control. There are certain overarching principles. There are different approaches which can be used to achieve these global action plan for the control of non-communicable diseases. These are human right approach, equity-based approach, multi-sectoral action, life course approach, empowerment of people and communities, evidence-based strategies, and universal health coverage. In human right approach, it should be recognized that the enjoyment of the highest attainable standard of health is one of the fundamental rights of every human being without distinction of race, color, sex, language, religion, political or other opinion, national or social origin, property, birth, or other status. In equity based approach, we can deal with it should be recognized that the unequal burden of non-communicable diseases is influenced by the social determinants of health. Action on these determinants, both for vulnerable groups and the entire population, is essential to reduce the overall burden of non-communicable diseases and create inclusive, equitable, economical, productive, and healthy societies. Multisectoral action. It should be recognized that effective non-communicable disease prevention and control require leadership, coordinated multi-stakeholder engagement, and multi-sectoral action for health, both at government level and at a level of a wide range of actors. Government approaches across sectors such as health, agriculture, communication, education, employment, energy, environment, finance, food, foreign affairs, housing, justice, and security. Opportunities to prevent and control non communicable diseases occur at multiple stages of life. Intervention in early life often offer the best chance for primary prevention. Policies, plan, and services for the prevention and control of non communicable diseases need to take account of health and social need at all stages of the life course, started with maternal health, including preconception, antenatal, postnatal care, and maternal nutrition. This phenomena we can achieve in a we can take in a life course approach. Empowerment of people and communities. People and communities should be empowered and involved in activities for the prevention and control of non communicable diseases, including advocacy, policy, planning, legislation, and service provision. Evidence based strategies. Strategies and practices for the prevention and control of non communicable diseases need to be based on scientific evidence. We can adopt a universal health coverage phenomena to deal with this global plan of action. All people should have access without discrimination to nationally determined set of needed promotive, preventive, curative, rehabilitative, and palliative basic health services, provide medicine and diagnosis which are essential, safe, and curative. Now we come towards the voluntary global targets 2025, which are set in this global plan of action. There are set of 9 voluntary global targets for achievement by 2025 for the prevention and control of non-communicable diseases. The target related to a 25% relative reduction in overall mortality from cardiovascular diseases, cancer, diabetes, or chronic respiratory diseases concern premature mortality from non-communicable diseases between age 30 and 70. These are 9 global voluntary targets. A 25% relative reduction in the overall mortality from cardiovascular disease, cancer, diabetes, or chronic respiratory disease. 10% relative reduction in the harmful use of alcohol as appropriate within the national context. A 10% relative reduction in prevalence of insufficient physical activity. 30% relative reduction in mean population intake of salt and sodium. 30% relative reduction in prevalence of current tobacco use in person aged more than 15 years, a 25% relative reduction in the prevalence of raised blood pressure or contain the prevalence of raised blood pressure according to national circumstances, halt the rise in diabetes and obesity. At least 50% of eligible people receive drug therapy and counseling, including glycemic control to prevent heart attack and stroke. 80% availability of the affordable basic technologies and essential medicine, including generics, required to treat major non communicable diseases in both public and private facilities. This is the diagrammatic representation of these 9 voluntary global targets. And you can see in the picture 25% reduction in the mortality, 80% coverage is given in the form of medicine and technologies which are essential for non-communicable diseases prevention, and 50% coverage are given by the drug therapy and counseling. 0% increase in the diabetes and obesity, 25% reduction in raised blood pressure, 30% reduction in tobacco use, and also 30% reduction in salt and sodium intake, and 10% reduction in physical inactivity and harmful use of alcohol. Now comes the national policy for the control of non-communicable diseases. This action plan has been modeled on an integrated approach to the prevention and control of non-communicable diseases and health promotion. It delivers an integrated framework for action which narrow down the broad agenda for the prevention of non-communicable diseases. In national policy for the prevention of non-communicable diseases, they main focus on the public and private partnership in our country is very much needed for the prevention of non-communicable diseases. The multidisciplinary nature of this approach for the prevention and control of non-communicable diseases warrants change at the level of individual, community, the health system, and health policy maker. This diverse playing field is an ideal setting to approach through a private public international health agency partnership arrangement. We can also use the integrated approach towards non-communicable diseases, and there are different forms of integration, disease domain integration. The term NCD is technically reserved for a group of preventable diseases that are linked by a common risk factors like cardiovascular, chronic lung condition, cancer, and diabetes fall within this category. Action level integration, the paradigm of non-communicable diseases prevention referred to above is multidisciplinary in nature. It calls for a diverse range of action involving policy development, legislation, regulation, public and professional education, guideline development, media intervention, and research. System level integration. The approach adopted as a part of action plan horizontally integrates the NCD prevention agenda with existing public health, primary health care, and social welfare infrastructure. Integration of concept. These include a behavior research and social marketing, guided communication strategy, and active role for local opinion leaders and educational institute, reorientation of health services to a more preventative orientation. Evidence-based approach. This effort is an example of the incorporation of core public health principle into country health program planning through an approach that seeks evidence based before planning intervention and utilizes intervention monitoring to generate further evidence. Maximizing the strength of partnership. This initiative also created a mechanism for visible involvement and participation of relevant ministries, educational institutions, NGOs, and leadership foci at a national consultation level and created avenues for their participation. Linkage the all policies with national health policies. A careful review of Pakistan's current health policies shows that this action plan is set within the existence policy framework. It main focus on the prevention and control of diseases that are both hazardous and largely preventable. Relationship with development agenda. Poverty eradication has assumed a center stage position in the global development scenario. However, in addressing health issues within this framework, global attention remains focused on health associated goals embodied in the Sustainable Development Goals. Unrealized ancillary benefits. This strategy outlined in this action plan has many ancillary benefits that have not been addressed directly. Ancillary benefits are those benefits which are not given directly but they indirectly benefit the people. The action plan brings health benefits to all other age groups, assist with healthier lifestyle that are also essential to reproductive health, enables a reinforcement of the nutritional strategy and promote prevention related practices which have implication for disability such as cataract. Action plan specific description and clarification. The national action plan which are formed, it is clearly defined There are clear definition of non-communicable diseases in this action plan. Activities originating in different part of health sector need to be synchronized for a concentrated action aimed at reduction in disease-related mortality and morbidity. We can settings over priority for the achievement of this national action plan. Priority setting is imperative for the rational utilization of resources for public health program in a country. The combined approach matrix is used to assist with setting priorities. This approach is found to be a useful tool for organizing information. What are the common areas of action in this integrated framework of action? There are two set of strategies. The first strategies include behavior change communication, reorientation of health services, monitoring and surveillance. The second pertains to legislative and regulatory matters. The aim of community intervention as a part of this action plan is to support the evaluation of a set of cultural practices that get embedded as a lifestyle habits within the population of Pakistan. The integrated framework of action focus on modifying individual, group and community behavior through media and other community intervention and targets individual in appropriate settings. There are need to reorientation of health services by the training of health professionals for better the infrastructure at healthcare settings. There are list of essential life-saving drugs which are provided at basic healthcare level. And at the end, research. This action plan attempts to bridge the gap between academic researchers and policy makers and administrators engaged in planning evidence-based strategies for bringing about an improvement in health outcomes. A necessary prerequisite for effective planning, implementation, and evaluation of non-communicable disease prevention program is access to reliable and timely information on mortality, morbidity, risk factor, and their socio-economic determinants, which is the common area of action. This is in this diagram, these are the uh, level of prevention, which are primordial, primary, secondary, and tertiary level of prevention. And the main focus are given to the primordial prevention with and health promotion. Then we can healthy over community. This is particularly important in Pakistan's healthcare and cultural context, where community health intervention should logically be structured to draw support from the extensive network of healthcare providers at grassroots level. And there is a strong tripartite partnership between the Ministry of Health, WHO, and Heartfile has been set up to lead this plan of action fulfill. Now it's time for recent updates. These are the stats of Pakistan in which there are different percentages of disease, and the major disease which are facing nowadays to the community is high blood pressure, and then oral and dental health problems, physically disabled person, and then diabetes mellitus, stroke, and some other diseases. Basically, there are four. This is the diagram which show 4x4 agenda. Previously, there are four risk factors and which share the four diseases non-communicable like physical inactivity, alcohol abuse, tobacco, and unhealthy diet. All risk factors are involved in the disease like heart diseases, diabetes, cancer, and chronic lung diseases. But in third United Nations high-level meeting on non-communicable diseases, the HLM3 2018 political declaration was adopted in the opening segment It features 13 new commitments and transformed the 4 into 4 agenda into 5 into 5. And they include air pollution as a fifth risk factor and mental health as a fifth disease. Now it's time for the MCQ. In the global plan of action of prevention for non-communicable diseases, it is recognized that many approaches work together because of common risk factor. Which type of approach is explained in this statement? Integrated approach, equity-based approach, human right approach, multi-sectoral approach.
Integrated
A.
approach.
Integrated approach A is the right answer. The HLM3 Political Declaration on Non-Communicable Diseases transformed 4 into 4 agenda into 5 into 5. Which risk factor is added in this agenda? Unhealthy diet, alcohol, smoking, air pollution.
D.
D, air pollution is added in as a fifth risk factor in this agenda. The paradigm has been suggested for the control of non-communicable diseases. Which level of prevention constitute the major part of this paradigm? Primordial prevention, primary prevention, secondary prevention, tertiary prevention.
A.
A, primordial prevention is the right answer. There are 9 voluntary targets for Global Action Plan 2025. In these targets, how many reduction of salt and sodium intake is highlighted? 10%, 20%, 30%, or 40%?
30%.
C.
C is the right answer, 30%. There are 9 voluntary targets of Global Action Plan 2025 for non-communicable diseases. In these targets, how many reduction of alcohol use is highlighted? 10%, 20%, 30%, 40%.
A.
A is the right answer, 10%. In the prevention of non-communicable diseases, many health professionals suggested the healthy lifestyle, and this is also beneficial for healthy reproductive system. Which type of benefit depict in this statement? Co-benefit, ancillary benefit, disability benefit, medical benefit.
A.
Ancillary benefit, B. Ancillary benefit defined as the benefit which are given, which are uh, meet by as a bonus, like if we adopt a healthy lifestyle, they can cure many diseases, but it also benefit the healthy reproductive system. So they give co-benefit to us. So this is known as ancillary benefit. In the global plan of action, it is highlighted that standard of health is one of the fundamental right of every human being without distinction of race, color, sex, language, religion, and politics. Which type of approach is this? Human right approach, equity-based approach, life course approach, multi-sectoral approach.
B.
B.
A, human right approach. In the global plan of action, it is decided that action on the determinants of health, both for vulnerable groups and the entire population, is essential to reduce the overall burden of non-communicable disease. Which type of approach is this? Human right approach, equity-based approach, life course approach, evidence-based approach.
B.
B is the right answer, equity-based approach. In the global plan of action, they can decide that promotive, preventive, curative, rehabilitative, and palliative basic health services is required for everyone without discrimination. Which type of coverage is this? universal health coverage, basic health coverage, primary health coverage, secondary health coverage.
A.
Universal health coverage A is the right answer. In the global plan of action, they can focus that if we provide benefits to the individual at antenatal, natal, postnatal, and maternal benefits, which type of approach is this? Human right approach, equity based approach, life cost approach, multi sectoral approach.
C.
C, life course approach is correct answer. This is the key of my MCQs, references of my presentation, and thank you.
Okay, thank you very much, Dr. Meha. Sorry, Dr. Naila. Very nice presentation, and inshallah, see you tomorrow. Inshallah.
Oh, okay, ma'am. Thank you very much.